This is a 79-year-old male who is a reliable historian who came into the clinic by himself. He follows up with Dr. Tan every 3 to 6 months for evaluation of his oxygen use, COPD diagnosis, and any other complaints. On today's exam, he had complaints of increasing shortness of breath. The shortness of breath started 2 weeks ago, and he has not been able to do his housework because of the increased shortness of breath. He says it gets worse with activity and when outside. It lasts until he stops his activity or goes indoors. His oxygen and albuterol alleviates his shortness of breath within a few minutes. He does have to use his albuterol once or twice a day for shortness of breath, which is not normal for him. Usually, he only uses his albuterol once or twice a week. Prior to these 2 weeks, he does occasionally get short of breath with activity, but the frequency in the last 2 weeks is not normal for him. He says he gets shortness of breath at least 3 times a day within the last 2 weeks. He's worried about the shortness of breath, but thought it was just allergies. Does not take anything for his allergies. Also, within the last 3 days, his phlegm has changed to light green. Usually, his phlegm color is clear and thin. The phlegm color change is not normal for him. He says he has had an increased amount of phlegm the last couple of weeks, but it just recently turned to light green. It is thick, and he's able to cough up all the sputum. He finds it more aggravating with activity and when he is outside, but he coughs up phlegm throughout the day. Nothing relieves the phlegm. Coughs up phlegm at least 3 to 4 times a day. Said the reason he came in today was just to get a checkup and didn't realize his increased shortness of breath and phlegm changes were anything to worry about because of allergy season. Both problems are making him stay in the house for fear of having an exacerbation. He's had no recent hospitalization. Patient stated his general health is okay, but the shortness of breath is causing fatigue and decreased strength with activity. He is positive for hypertension, COPD, hyperlipidemia. He had a myocardial infarction 10 years ago and a smoker for 20 years and stopped 10 years ago. Smoked a pack a day. He does use 2 liters of oxygen at home, at night, and also during the day when he needs it. He did have a cardiac catheterization with stent placement about 10 years ago per the patient. Unknown vessels, but knows he had 3 stents placed. He does have allergies to sulfa drugs. He says he's up to date with his immunization, especially his pneumococcal vaccine, and he gets his flu shot every season. The patient's on Lipitor 80 milligrams daily, Plavix 75 milligrams daily, lisinopril with hydrochlorothiazide 20 and 12.5 daily, Nexium 40 milligrams daily, potassium 20 MEQs daily, and uses his albuterol inhaler as needed for shortness of breath. He does not have any recent labs within the last 6 months. Father died of a myocardial infarction at the age of 60. Father was positive for hypertension and hypolipidemia. Mother died of breast cancer at the age of 75, but does have sisters who is alive but has unknown medical problems. He is a Caucasian, retired military, and lives at home with his wife. No kids, does not use alcohol. Like I said before, he stopped smoking 10 years ago. Does try and stick to a low sodium and decreased fat diet at home, does do chores around the house and outside as able for his exercise. On review of his system, patient does not have any fever or chills, says he feels okay except for the phlegm and the shortness of breath. Skin, hair, and nails are all intact, no headache, syncope, or dizziness, no vision changes, hearing loss, or discharge from the ears. Patient stated he does get stuffy when he goes outside. In the last 2 weeks, it has been worse. Otherwise, no changes in sense of smell, no sore throat, no changes in voice, and no problems with dentition, no swollen lymph nodes. On chest and lungs, he has had the increased shortness of breath, light green phlegm, and wheezing with the shortness of breath. Last chest x-ray was 1 year ago and stated it was normal. No chest pain or edema, no bruising or claudication with walking, no decreased appetite, no nausea or vomiting, no changes in bowel movements, does stick to a low-fat and low-sodium diet, does not take any herbals, no heat intolerance, no unexplained weight loss, no dysuria, no pain, urgency, nocturia, hematuria, dribbling, or incontinence with urination. No joint pain, no syncope or seizures. Patient does not complain of depression, mood changes, or any kind of memory loss. On physical examination, the patient is well nourished, blood pressure sitting down as 122/74, heart rate at 84, and regular, temperature 97.3, biaxillary 96%, oxygen on 2 liters nasal cannula while sitting down, and on room air patient is 84%, height is 68 inches, weight is 174 pounds, and the BMI is 26.5. On physical examination, the patient's alert and oriented times 3, calm and cooperative with questions. Patient is coherent and appropriate with questions and answers. Skin is pink and uniform, no visual lesions. Head is midline, no edema, no tremors. Eyes pleura, ears midline, no discharge. Throat and mouth, teeth intact. Mucous membranes pink and intact. Moist, no discharge, no external deformities, and no sinus tenderness to the nose. Decreased lung sounds to bilateral bases. Increased expiratory wheezing heard throughout the upper and lower lobes on the right and left side. No tenderness or retractions. Breathing is regular and unlabored while sitting in the chair. Heart rate is regular, no murmurs, no edema, strong pulses felt throughout. Patient's bowel sounds are regular and normal, no abdominal tenderness, no distension, posture is upright. Patient does walk slow but no stutter steps, only uses oxygen equipment for stability. Assessment: COPD, exacerbation, dyspnea, hypoxia, and allergic rhinitis. Differential diagnosis would be COPD exacerbation, acute bronchitis, and allergic rhinitis. Plan for this patient is to return to clinic if conditions worsen, follow up in the clinic in 3 months, continue current medications, and add Spiriva for better control of shortness of breath and wheezing. Patient stated he did take this in the past, it did help, but he has not had a prescription for the last 6 months. Continue on 2 liters nasal cannula during the night and PRN is needed during the day. Start patient on cefuroxime 250 milligrams BID for 10 days for the acute bronchitis. Kenalog IM 10 milligrams times 2 for the COPD exacerbation and allergic rhinitis.